No, all right, welcome back to another episode of the Holistic Health and Weight Loss docu-series. Our next featured expert is John Ossipinsky, also known as LymphMan, and he will be discussing NIH reports finds disease begins with lymphatic dysfunction. John understands myth science of the lymphatic system that can dramatically improve mental and physical health. He is an author, lymphatic medical intuitive health coach, and developer of LymphPractic. He has studied and worked with the lymphatic system for almost 30 years, helping global clients improve their lymphatic system and to help conquer their health and life goals. So, welcome, John. So happy to have you with us today.
I'm so glad to be included in this, Pamela. You really put on some great docu-series, and hopefully we're going to learn a lot today. I'm going to open up their eyes. I don't think they're going to forget about the lymph system after this.
Yeah, we've had some questions about it already. I said, John's coming. He's going to have you covered. So you do have you've been trained by some really great experts, but tell us a little bit about your journey. How'd you come to be doing what you're currently doing? Because this was not really your expertise early on.
No, I've always been somebody to help people. I was always the guy who helped the bully. I was a lifeguard. I was a medic in the U.S. Army. I was a New York City firefighter. So people say I have a savior complex. And now I became a certified lymphedema therapist and craniosacral and diplomat certified in craniosacral therapy, meaning I understand the lymph system, but I understand its connection to the brain, especially. And that's what's missed in medicine. So I am someone who still feels like I'm helping people, right? I understand science that's
Absolutely.
missed in medicine, and we all need to understand this science. There's no one who doesn't have a lymphatic system. And I'm going to show you today how most disease has been found. I wrote this 20 years ago, how most disease is due to your lymphatic system not flowing. And now NIH, the National Institutes of Health, in 2023, they put out a statement, and we'll go over that in a minute, that basically says, hey, your disease begins with lymphatic system
Oh,
dysfunction.
wow.
And no one even knows this, not even your doctors.
I was
So
gonna say they're
it'll
finally
be
admitting it.
decades. Yeah, it'll be decades. You know this. You're a nurse. You know we don't talk about the lymphatic system in health unless you have the big C, cancer. That's when we
Yeah.
start talking about it. But we need to start talking about it a lot earlier. So I was fortunate to learn from three world-renowned doctors: Dr. Upledger, craniosacral therapy, then Dr. Burrell, a French the physician on the organs, how to release the organs, and then really what moved me the most was Dr. Bruno Ciccoli. He wrote a book on the lymphatic system, 460 pages. That's your superficial lymphatic system. And he basically is a little different. Most people who write about the lymph system and how to treat it, like manual lymph drainage, it's more about cancer. He and swelling. He talks about that, but he also talks about how it's every body system is cleaned by your lymphatic system, every cell in your body. And that's when I got the idea that, well, maybe then a lot of our diseases are connected to the lymphatic system.
Mhm. Yeah, yeah.
And
So
basically, oh, go ahead.
I was going to say, so we're going to talk about that today in the NIH studies. I'm so curious since it's been 2023. So yeah,
Yeah, it's right
yeah,
here. Again, it's right here. Let me share. Can I share my screen a minute? And if you guys
absolutely.
have any questions, you're welcome to put it, I believe, wherever you're getting it, and Pamela will get them, and I will answer them for you. But I'm going to share my screen. Is that all right, Pamela?
Yes.
All right. I'm just going to share my screen. Just take us a second. This is going to be a short. The presentation that I gave you guys, this is being recorded. It's not letting me. Okay, here it is. Sorry. Uh, there we go. Sorry about that.
Okay.
There we go. So every single one of us, and I've been doing this again, educating people about the lymphatic system for 30 years. No, every person who comes in my office, I say, "Well, what do you know about your lymphatic system?" I was actually talking to a painter yesterday who came for an estimate, and I said, "Do you know about your lymphatic system?" He goes, "No," and that's what I get from most people.
Yeah.
So how can we ignore a system that's meant to clean your skin, your muscles, your bones, your brain, your organs, and really every cell in your body? So my goal today, right now, it's going to go through like 8 slides. In my presentation that you get in my free gift is like 32 slides. So you're going to really get the full layout of it in that. So make sure you get it. And plus, we're going to show you how to do a couple of things at the end, how to
Mhm.
open up your lymphatic system. So
Yeah.
we all have this system. It has to flow. Think of it as a plumbing system, right? It starts anywhere in your cells and goes into the lymph vessels, goes into some nodes, maybe goes into a vein, but ultimately, it has to end right here in your neck in one little vessel, one tiny little vessel on either side of your neck, smaller than angel hair pasta, if you can imagine. And what happens when we sit, if you're a person who sits on a computer a lot, most of us work for a living. If you're a course creator, you write things for a living.
Yeah.
We're over a computer for decades sometimes. And no one's told us that when we sit and bend over a little bit, we slow or stop our lymphatic system. So when you bend, that's the first thing I want you all to do now. Sit up straight. As soon as we slouch a little bit to look at the computer, you're stopping and slowing your lymphatic system. And now that I made you aware of it, you're going to feel that, right? So be aware that everything has to flow here. Everything in your head has to flow down. Everything in your body has to flow up. I had IBS for 30 years. I had restless leg syndrome, heart palpitations for a few months. My hands were cramping. I couldn't hold things. They'd fall out of my hands. My hair and beard were falling out. I be 70 pounds overweight. Once I started maintaining this system, everything changed. My IBS went away. My brain actually popped. I felt my brain pop, right? We're filling with waste when this system is not cleaning us. So we need to gain control over it. If you have digestive issues, is it cleaning up? If you have heart issues, is it able to clean the waste out of your heart, right? We're missing this totally. If you have breast disease or breast cancer or breast inflammation, is your underarm nodes, is the vessels in your neck able to accept waste from your breast? And I can tell you, it's not. So we all have a system that's meant to remove fluid, fats, proteins, fibrin, enzymes, urea, and minerals. The whole list of things that the lymph system must remove. And if it's not working, and we only have one little vessel in either side of our neck, then you fill up with fats. You get fatty liver, you get fatty cysts, fatty tumors. We get fat in our brains, we get fat in our organs. Fibrin is fibrosis. Your body gets filled with fibrin and you get hard and your body can't flow and we get inflammation and disease. How many of you have hormonal problems, right?
Mm.
Hormones are due to the buildup of the lymph system not being able to clear hormones out of your body. And if you're not able to produce hormones well, then maybe your lymph system isn't cleaning the glands or where they're made. But it's really everything. Is your body able to get rid of cancer, bacteria, viruses? If your lymph system isn't flowing well, it's not going to be able to do that as well because your immune cells are dependent on flow through your body. And I can tell you the lymph system must complete circulation. And it's not doing it. It's not doing it at all on most of us. And
Mhm.
that's what's
Yeah.
creating most of our diseases. So on the left here, you see the deeper lymph flow that's throughout our whole body. And it's not just one layer, it's in your muscles, outside your muscles, in your nerves, inside your organs, outside your organs, in your blood vessels, outside your blood vessels. It's everywhere in your eyes, in your brain. So we have
Mhm.
to start thinking more about this system. And here on the right side, if we can see it, that is your superficial lymphatic system. That's right under your skin. And that's why we see things like histamine releases. People have the MTHFR gene. We get allergies and our skin erupts, right? It's because our superficial lymphatic system is not flowing. If you have pimples in the middle of your chest or the middle of your back, it's because your lymph system isn't clearing that waste. Once we understand the lymph system, a lot of our health problems become really easy to understand. So here's the big thing, and I miss this. I'm on a computer every night to understand the lymphatic system. And thankfully, I found this a few months ago. And in 2022, NIH went out to all its researchers and said,
Mhm.
what do we, and they're worldwide, they're around the world. What do we need to study with the lymph system? What are we missing? And this was eye-opening, right? It's yet to be charted, lymphatic system and health and disease. You can actually go to study, and there are videos of them talking about this for days. So it's really very, very interesting. And what they found was that the meeting objectives, let me move this over here. Meeting objectives, internal experts will discuss current research, explore knowledge gaps, and identify opportunities in lymphatic disease research. And this is what I want you to realize. The government for 30 years has been concentrating on lymphedema and
Mhm.
cancer. That's what the lymph system is for. That's it. Nothing else really. Uh, so this here, they're about to do this big study, and they're saying, okay, yeah, we're going to talk about lymphedema and lipedema. Now, I never heard of lipedema, even though I was a certified lymphedema therapist, until I published work in 2006 on how most diseases due to buildup of cellular waste. And then I started hearing from women around the world saying, oh, I have this, my legs are swelling, and I also have my hair falling out, and I have eczema, and I have digestive issues. And I started to learn that most of our problems with swelling also affect us in other ways. So understand their focus, and that's what they were really concentrating on, was lymphedema. Workshop organizers hope the event will build collaborative partnerships among scientists, clinicians, patients, and patient advocates. Featured topics include lymphedema and the role of lymphatics in obesity. That was their focus. All
Mhm.
right. Now, come a year later, they got to finally talk about this study, the NIH workshop report, Emerging Importance of the Lymphatic System. And I really, when you get my free gift, you'll get a link to these. And I really go look at it. It's probably a lot more than you should know for most people, but it's eye opening what they found. And here's what I pulled out of it. They mentioned that changes in normal lymphatic function can alter multiple systems in the body and manifest as different and varied pathologies. Pathologies meaning, what type of diseases. There are many conditions related to lymphatic dysfunction within all body systems. That means every health problem you have is really due to, because the lymphatic system cleans every cell in your body, and it directly or indirectly cleans every organ in your body, every tissue, everything. Let's get to that. So here's what they found. It's basically your central nervous system, Alzheimer's, the dementia, aging,
Wow.
small, the vessel disease in the brain, traumatic brain injury, the lymphatic system, cardiovascular, heart failure, myocardial fibrosis, pericarditis, hypertension, urologic problems like kidney fibrosis, renal lymphangiectasia, meaning your kidney, the vessels are swelling, chronic cystitis, Ki polycystic kidney disease. Sorry, I'm trying to get a lot in this time. I want you to know a lot. Tumor metastasis. They talked about, they said, here, all these cancers, but they said, oh, we didn't mention blood cancers because we know they're due to the lymphatic system already. So again, if you have any type of cancers, it's due to the lymphatic system. If you have any skin problems like lymphedema, lipedema, eczema, atopic dermatitis, scleroderma, aging, you're losing your hair. Where do you know it has to do with free radical damage and lack of circulation. And another study came out to say if you want to help your hair, you got to include the lymph system because it cleans the hair bulb, right? And if
Mm.
you can't clean your hair bulb's going to die, your hair's going to die. It becomes so easy to understand the lymph system's value once we understand it. Remember, most people don't even know the words of it. They never heard it until they get cancer. Everything with your eyes, everything with autoimmune diseases, lupus, multiple sclerosis, Sjogren's disease, rheumatoid arthritis, right? Pulmonary fibrosis, anything with the lungs, GI system, so any digestive issues. That's why my IBS, I had for 30 years, diagnosed for 20. It was horrendous. A couple of weeks into activating my lymphatic system, my life changed. I had no more IBS. And it's been that way for decades now. So everything that we have, even arthritis, psoriatic arthritis, fibromyalgia, is really all due to your lymphatic system. And again, this is what they're researching. I realized this 20 years ago. Everything I
Yeah.
wrote has been coming true in the last 5 years. Now we know NIH is even agreeing with me. Okay.
Mm.
So we all
So
have to understand
Karen
this.
commented OMG from seeing that
Yeah.
list. And
Isn't
she
that
had a
crazy?
yeah, and she had a question, can one smelly underarm, just one, is that from lymphs not draining?
It's from your body being toxic. Anytime we smell, and I once had H. pylori. I didn't
Mm.
realize it before I understood this, and my navel got all irritated. It was a little funky. And you know what? That's your lymphatic system not being able to clear waste. So anywhere in our body, whether it's your pelvis, your underarm, your breath, it's because you have toxicity in your body, the buildup of cellular waste, and the lymph system has to clean it. And what happens is we become acidic. So in my book years ago, I wrote that when we become acidic in our body or brain, it stops your lymphatic system. Think about it. We actually constrict, right? When you feel tightness in your body, that's your body becoming slightly acidic. And you don't have to have any symptoms or tightness to have it damaging your bones or your organs. But now we know, just came out. I wrote that 20 years ago. In April 2024, brain acidity linked with multiple neurological disorders. Anybody have a neurological disorder? There are over 600 of them.
Mm.
And in a study, a team of 131 researchers from over 100 different laboratories around the world have demonstrated that decreasing pH, meaning when the brain becomes acidic, levels in the brain or increased acidity are a common feature of a diverse range of neurological disorders, including depression, epilepsy. You can include anxiety in there too, autism, schizophrenia, intellectual disability, bipolar disorder, and Alzheimer's. I mean, this is key. They're linking acid in your brain. And what cleans acid in your brain? Your lymphatic system. And really, you have to watch my study later, my free gift. It will open your eyes even more than this is. I get excited
Yeah.
about this, and I've been
Yeah.
talking about it for 20 years. So this is key.
And the
Brain.
fact that it's 100 different laboratories around the world, oh my goodness.
Right, it's not just me writing a book anymore,
Yeah.
right? It's not just me saying, "Hey, we're acidic." It's now they found us in the brain, and trust me, they linked these few, and others, they're all gonna be linked to,
Mhm.
acid in the brain because that's really what's happening. We don't understand how we spend $2 billion a year on antacids and Prilosec and
Yeah.
products like Prilosec. We think that's just a digestive issue. It's hurting our brain, our organs, our bones. Every disease is linked to this. So what I want people to really take away from this, and we're almost done with this, and then we'll ask them some questions and I'll talk more, is that this is your major lymph drain. Remember when I talked about the white vessel? That little white vessel, right, is really where all the lymph in the body, and there's vessels everywhere, thousands of them, hundreds of lymph nodes, 6 to 700 lymph nodes in the body. And if they can't, if this can't flow, then they're going to back up with waste. And that's why we get swollen lymph vessels, swollen lymph nodes. And if you have any digestive issues, understand they took away all the lymph nodes and vessels that are here. But I had IBS all my life. So I really want to help people with that because it can go away quickly, as I believe most problems. And I don't believe in curing because I'm not a doctor. I don't cure people. What I do is I teach people how to manage their health with the lymphatic system and diet and basic supplements and some exercises. And then with their own two hands to where within a couple of weeks they feel totally different and they're managing the inflammation in their body and then they have a chance of overcoming an illness. But for many people, if they have, end stage disease, it's more about quality of life. Right now they're very inflamed. If they can get rid of this inflammation, they could do a lot better. So when I started, and a recent study came out about the intestines, saying that after chemotherapy, when the intestines are damaged, they saw that you have to include the lymphatic system to heal it because the lymphatic system in the intestines make a molecule that makes healthy stem cells. So why did I
Mm.
have 30 years of IBS? Because my lymph system was not clearing waste from my intestines. It couldn't make that healthy stem cell because it couldn't make that molecule. By activating my lymphatic system, I improved flow through my intestines, and my problems went away. But it's something we have to do often. But if you have kidney disease, if you have heart disease, lung disease, same thing. We have to get the body cleaning that area to get the cells to change. And that's what I'm a master of, changing the cellular environment, right? It's not just about draining. You go on TikTok, have people show you. A lot
Yeah.
of them, there are a few really good ones like a Lymph
Mhm.
Love Club, but there are other ones that, I don't know what they're doing. So I learned from one of the best doctors in the world. Trust me, what you get from me is going to be something you feel. You're going to feel things flowing through your body. So your intestines must clean up. So if you have SIBO, you have Crohn's, colitis, trust me, these vessels are also here on your colon, right? There's your appendix down here. And if these vessels can't clean up into these areas, then they back down and they leave waste in your intestines. And that's why people have to get their colons removed often because of inflammation, right? It's all because this system can't clean. So we have to gain control over it. But right now, I want you to really concentrate on your shoulders and neck. This is what we have to keep open. We get tight in our shoulders, we're limiting lymph flow. You slouch, you're limiting lymph flow. So
Mhm.
we want to be more aware of sitting straight. I'm going to show you the LymphMan shoulder shuffle in a little while, and stretching is very important. All right, so we have this system that must clean us. And I hope you see my passion and my excitement for this because I get excited about it all the time. This isn't just something I talk about. I believe it's life changing. So if you're having any health problems, no matter where it is in your body, think of this system. Think of these green lines. Is your lymph system able to clean a certain part of your body? And when we're aware of a certain part of our body, we shouldn't really feel our body. We shouldn't feel it. Everything should feel pretty good. But if we're aware of a certain part of your body, that means that part of the body is not getting circulation because the lymph system isn't cleaning it.
Mhm.
So we have to get circulation going there. But like if you have problems in your legs, we don't want to just concentrate on the legs. We want to concentrate on here. We have to open up this up all the time. And that's why if you go to TikTok, John Ossipinsky, LymphMan, almost every day, a few days a week, I just get on, I show people, hey, let's do the LymphMan shoulder shuffle, right? I did that 4 times. My body's tingling. I could feel flow through my whole body. So again, check that out if you'd like. I think that's our last slide. Let me see. That is. All right. So let me stop the share. Anybody find that exciting or interesting?
So Rosie said she's excited. Wow. How do we find a reliable therapist? You mean
You
to
can
teach?
type into, even though I believe you should see a therapist, right? And they're all different types. You can see a
Mhm.
massage therapist who does a lymph massage,
Yes.
if that's
Mhm.
be convenient. You can see somebody who does MLD, manual lymph drainage, or lymph drainage therapy. That's what I learned, lymph drainage
Mhm.
therapy with Dr. Bruno Ciccoli. But I would also include, just put in your browser when you search in your area, put lymph drainage therapy, craniosacral therapist in my area, lymph drainage therapist, craniosacral therapist in my area. They're very hard to find, but that would be somebody more like me who understands it. And I'll talk a little bit about people who use those machines and stuff. If
Mhm.
you can try it. They're they're really just, I know they have different things in them and lasers, whatever, but they're just moving your lymph. You can do the same thing yourself. That's what I teach. So even though you may go to a therapist, that you go once in a while, once every 2 weeks, 3 weeks, some people go weekly, I would see. But, it's what you can do daily. It's what you can
Mhm.
do every day. Anybody know how many cells die in your body every day? 500 million. And that's on a good day. If you're on antibiotics, you're on any type
Yeah.
of medications, you're very inflamed with anxiety and depression or swollen legs or heart disease, then you're going to have a lot more cellular waste, right? So we have to really think about it every day that you're not maintaining your lymphatic system, then we're missing it. Right, we really are missing that we can gain control over it. So even though it's good to see a therapist, find one in your area.
Mhm.
You want to learn how to do it yourself.
Yeah, yeah. So, John, for those who aren't familiar, what is a craniosacral therapist?
Craniosacral therapy, and that's the first work that I learned after massage
Mhm.
therapy school by Dr. John Upledger. He has a great big organization. They teach it around the world. They're based in Florida. And craniosacral system is your membranes that surround your brain and spinal cord. And Dr. Upledger we work with the cranium, we work with the body, and we just really just hold very gentle, and the body just releases. It's amazing. And that's what I became the diplomat certified in. I even worked in their clinic for a little while. And then I learned about the lymph system. And in craniosacral therapy, even though they specialize in the brain, they never talk about the lymph brain connection. So to me, if you're a therapist who does craniosacral therapy, you got to learn the lymph system because you're missing out, right? We now know in 2015, lymphatic vessels were found in the brain. So we know the direct connection that we can use to actually clear. And one of the studies I think I show in the later PowerPoint, the presentation you can watch, is one study talks about the deep cervical lymph nodes, right? How
Mhm.
these vessels here, they saw in mice, aging mice, that their brains were not clearing waste through these deep cervical lymph nodes, the vessels. And what they did was they used a hormone and they put it on those vessels and it started to clear, right? They saw waste starting to clear again. And that's happening to all of us, right? I was 47 when my brain popped. I was already, my brain was shrinking.
Mhm.
So it's happening to all of us. So what they saw with this hormone is that it started to clean, but we can gain control over it ourselves by doing things like rinsing that I'm going to show you, doing the LymphMan shoulder shuffle. It's just that we're stuck here and then everything just backs up and then it backs up like a dirty garden hose and we have to shake it up and clean it and get it flowing. But we also have to change our diet. Diet is a big thing. Most people
Yeah.
don't realize that diet is so important. I ate the standard American diet. I love to eat. I'm not one of these people who are perfect. I've just learned to clean up. I become very good at using my lymphatic system to clean up for a short period, and then I can live my life because I don't want to just eat, you know, really healthy things all the time. I want to enjoy my life.
Yes.
But we have to understand that most of the foods we're eating, even things like spinach, they slow our lymphatic system, right? The standard American diet, but
Yeah.
certain even vegetables will slow our lymphatic system.
So I had a question. Are there possible damages from cranial sacral treatments?
No, what happens with most people is we don't realize that we are storing waste in our body, right? I work with many people who look terrific. They look like athletes, but unfortunately their lymph system isn't working and they're storing waste in certain parts of their body. So when we start to move it out, like with craniosacral therapy, it's so gentle. If you're a person who's very sick, find a craniosacral therapy therapist. You just hold certain parts of the body and it opens up and it's amazing, right? But to me, even though they don't mention it, it's opening the lymph system because the areas that we hold are areas of major lymphatic vessels. So, what people feel after one of my therapies, and I'm also a medical intuitive. I do my work around the world. This week, I had somebody in Italy, somebody in Australia. Is I work with them energetically. I don't work in an office anymore, right? I stopped that after 26 years when COVID came out. I want to educate people, and I'm able to help people around the world. But what they feel, whether I did a physical or an energetic session, is people feel fatigue later. They get a little more of their symptoms. So what's happening is that people see this as a bad thing. Oh, I felt sick after that therapy. I can't do that anymore. No, we're so toxic. If we don't continually every once in a while clean up, we just stay toxic. So I tend to put people when I did the the physical worse, I would put people through 3 weeks of twice a week sessions and their lives would change, right? We would stimulate their organs, stimulate their cells. And we could do that same thing energetically. But often my energetic sessions are pretty powerful. People do a couple of sessions and they feel better already, right? I have an ability to open up the body. And my sessions are really I just talk to you. We record it on Zoom and I say, okay, I'm holding. Well, first I check your body. I do it intuitively. I close my eyes and I look at you and things pop out at me. And those are the things that are really more congested. Then I check your lymph flow in your body. I can actually see where it's flowing, where it's not. And then I actually open up your body. I say, I'm holding your clavicles. I'm draining your abdomen. I'm holding your eyes. I'm draining in your mouth, right? Even though I do almost the same exact thing on every person because we all have the same lymph system, I see different things in people and I find other things that I have to work specifically on them. And it's really very, very powerful. You can go to John Ossipinsky on YouTube and check out the testimonials. There's a whole bunch of them on there.
Mhm.
But what else we got there?
Yeah, just mentioning some health issues, fibromyalgia, arthritis, chronic pain, inflammation, overweight.
Doesn't it make it easier if we can manage one system in our body rather than say, what do I do for weight loss? What do I do for inflammation? What do I do for chronic pain? What do I do for fibro? We just saw the NIH study. Fibromyalgia, everything is going to be found to be due to the lymphatic system. So now you have to take steps to move it. And it's simple. Change your diet to eat a more green diet, right? Most people don't realize that. I hated vegetables most of my life. I didn't like them. I ate white rice. I like Chinese food, Asian food. I ate white rice, noodles, meat, fried meat. I'm Italian, so I ate a lot of pasta and a lot of meat and a lot of bread. I was a kid who went to the store down the block to get the Italian bread, come home with 3 loaves during the day, and I'd eat all the ends of them every day. How come we didn't get so sick back then, right? Now we
Yeah.
do, unfortunately. So we have to look at our food, but it's also magnesium. How many of you are taking magnesium, right? Most people will take, oh, I take magnesium to sleep. Well, we need magnesium for your cells. It relaxes your body and your lymph system can flow. So we need about 400 to 500 milligrams throughout the day. Don't take it all at once. Take some in the morning, some in the afternoon, some at night, right? Especially at night, you want it if you want to sleep better. But magnesium is a very, very simple thing that most people should be taking. Of course, check with your healthcare practitioner. What
Absolutely.
else? Let's see.
So I say, John, you had mentioned your telehealth sessions. My cat, who's currently on my lap, only comes on my lap when there's very intuitive people. So he always comes on my lap when John's on.
I
He can
love
always sense.
that.
He's
Having
turned
said
away
that,
right now.
when I work on people and they have an animal, when I start working on them, the animal comes right by them, and they say, "Oh, the dog or cat does not normally do that," but they feel these things, right? And I do work on animals too, even physically. I've worked on horses. Every mammal has a lymphatic system, right? And we have to learn to clean up cellular waste, and we do it with the lymphatic system. How about exercise? Any of you exercise? Do we need exercise?
You know
Right?
me, rebounder.
Good for you, right? Everybody has a rebounder. Make sure you pull it out of the closet. You don't need an hour. I'll tell you something about rebounding. When I was in my practice, 15 years ago, rebounding became very big in gyms. So they'd have all these rebounders. People would go in and do 45 minutes of rebounding. That's a lot, right? I
It's
do
a
10
lot.
minutes. And when I started seeing people, they would come to me, I don't know what it is, but I'm just swelling a lot. I said, well, what did you do? Well, I took this lymphatic course, the rebounding. So what happens is we're so toxic, our lymph system isn't working. We go do exercise or rebound. It takes more waste out of our system. It
Mhm.
overwhelms your lymphatic system even further, and it can be more damaging. And that's what happens with big box detoxes. You go to a store, you get a big detox and all
Yeah,
these
yeah.
things, and you're not well. Your lymph system isn't flowing. You do this big detox. This I saw this so many times in my practice, and people just end up being sick, staying sick. I don't know what it is. Well, you release so much waste, it shut down your lymph system further. So I've been doing this for 30 years, and actually with doctors, naturopaths, I got used to. They would send me people that they couldn't help, right? That they would say, John, they need more help. They were doing a little better, but once I started working on their lymphatic system, their life changed, right? So I saw this over and over and over again. And people who join our course, and again, we have a $97 course coming up. It's 4 weeks with me. We're going to drain everything in the upper body, right? Everything in the upper body, even inside the mouth. And we'll learn about diet, a few basic supplements, but we're going to sort of get into it. And then January 6th, 2025, we're having our 8-week course. That's our big course. And again, I used to charge a lot of money for my courses. You would get 6 months with me, you would get sessions. I'm semi-retired, right? I'm 66 years old. My wife says, hey, you're done. Let's go with something, but I can't stop. I can't stop educating the public. I just can't. How can I not teach people about this, right? I hope you guys all see this, that this is, and some people wrote that this is like, it's alarming,
Yeah.
right? It is alarming. I think that every day. And the most important thing that drives me is that it's affecting children. Even though it's affecting everybody else, I want to help them too. But being a fireman, being a parent, if it's hurting children, if a parent
Mhm.
can understand that if they, I'll talk about one study that I mentioned in my later one, is that for pregnant women, if anybody gets pregnant, you've got to tell them that the baby's lymph system in the womb, it gets developed a little bit, but then if they don't do activity, if they don't do movement and breathing and stretching, that the lymph system in the womb in the baby is not going to develop further. It's not going to mature, and that's a study that just came out a little while ago.
Oh,
So
wow.
anybody knows, anybody who's pregnant, tell them, hey, gentle exercise, but you can't just sit around. When my mom had us, she had 5 kids. At that time, the women would coffee clutch. The men would go to work. The women sat around, had coffee and cigarettes because doctors said cigarettes were okay, right? Crazy. And we all turned out okay, thankfully. The body is a remarkable piece of machinery. But if we can teach children, if we could teach moms that, hey, you have a lymphatic system, and that's what creates preeclampsia. Anybody know about preeclampsia? We had a friend who just had a birth. During her pushing to give birth, she got eclampsia, meaning that that intense pushing pushed waste out of her tissues and made her very
Mhm.
toxic, and it really affected her and a baby. Thankfully, they're okay. So if we can teach moms that they have to clean up gently in the first trimester, you don't
Yeah.
do anything big. You just change your diet, drink some water, and understand that you have a lymph system and need to move a little bit. You'll do much better. And magnesium is key in pregnancy, even though it's for all of us. But a lot of studies show that when women are having problems at the end of their, when they have be giving birth, they have to give them magnesium, right, to
Mhm.
relax them. So if we have magnesium in our body, then we're not going to have those problems. So
Mhm.
everybody should be taking magnesium, especially if you want some healthy
You're
children.
you're mentioning, kids, and now there's a lot of different tech that they're on, and their heads are like this.
Oh yeah. Yeah, and that's why there's a, and I'm not saying that's the only thing. I believe it's the missed lymph-brain connection, but you're
Yeah,
right. They're on their tablets for hours, kids, bent over. And once we bend a little bit, we stop here. Once we bend a little bit more, and you could feel it, everybody just bend over a little bit.
and
You
for all
feel
of
it
us too,
tighten
cell
here in your
phones,
neck.
Kindles,
And then
things.
when
Yeah.
you bend over further, you feel it, your ribs go into your abdomen.
Mhm.
You're stopping your abdomen from flowing, your pelvis and everything. And then we wonder why we have pelvic problems, hip problems, prostate, over, it's all because of flow. So we
Mhm.
have to get our sit up straight now, right? You slouch a little bit, and once you sit up straight, you actually will feel a little flow in your body. If you did that, if you slouch for a few minutes and then you straighten up, you will actually feel circulation. So we have this system that we can master, and it's easy. If you look at a lot of my stuff, people tell me, how easy it is that I teach it. I make it very easy. But I will say that my 8-week course, the first couple of weeks are a little intense. It's a lot of stuff that because we have so much to learn. I used to be with people for 6 months. There's the same exact course in two months. So it really is a lot. So it's taking my $97 course that's coming up on November 11th will help you go right through my other course because we learned the first basics of it, and then we go into learning the organs in our 8-week course. And that I never even taught about the organs, but we need to even know how to open up our organs with the lymphatic system. So I really teach you how to master your lymphatic system to master your life. How can we not take care of a system that's meant to clean us, right? All right, I'm going to show the LymphMan shoulder shuffle. You
That's
guys
my
ready to
question.
move your lymph system? You got a question?
I said that was my question. I'm like, tell us about the LymphMan shuffle.
All right, we're on the same path. There you go. I love it, Vanessa. There you go. She's doing it, right? But really do it when you do it. Now, if you have neck pain or shoulder pain, I've had surgery, I can still do it. Put your hands on your lap and just very gently, just straight up and down. But it has to be straight up and down and really push it into your ear. We want to stretch this area here where the major lymph vessels is, right? Are. So we just stretch it. Now, I did that. I feel tingling in my shoulders. I feel tingling in my legs. Now I want you to do it. If you have no pain, I want you to do it really fast, really fast, really fast. Come on, Pamela, get it going. There you go. All right. Vanessa, straight up and down, straight up and down. Oh, man, I feel like I did exercise. My arms are tingling. My legs are tingling. I could breathe easier. I feel flow in my head. I'm sweating a little bit from doing that, right? Because when we move the lymph system, it's like exercise. Now I'm going to teach you how to rinse the clavicles, all right? The clavicles are right here. It's where your major lymph vessel is. And we're going to put our fingers. I like to cross my arms. I cross my arms. Let me get a little water. We cross our arms, and then you put your fingers on your trapezius, not on the top of it, but your fingertips go into the muscle in the back. And then you slide down to the bottom of it, and then you pull forward towards your clavicle. And use your whole arm. Just pull. Use your whole arm. Use your whole arm and end on the clavicle. You can even put a little pressure into the clavicle because our clavicles are always a little tight. Every
Yeah.
time I work with clients, their clavicles are just shut down. I just did that 4 times. It made me wanna take a deep breath. So just make sure you're in the little indentation here in your neck, right? We got right above your bones and your clavicle. So make sure you are right above the clavicles with your fingers, and then just this little pump and pull. But don't just use your fingers, use your whole arm. Pump and pull. Pump and pull. And you can do this, you're standing in line at the grocery store, you're sitting at your desk. Just do this a few times a day. It's not what we can do like draining your whole body once a day or every couple of times a week. It's what can you do every day? Can you sit up a little straighter? Let's take a few deep breaths for the lymphatic system, all right? And how we breathe for the lymphatic system, and there are many type of breathing techniques, fire breathing, this breathing. I'm a medical intuitive. I can see lymph flow in people. So when we take a deep breath and let it out with force, I see it move through people in very powerfully. So what we do is we sit with good posture. And when we're going to take maybe 10 deep breaths, right now we'll just take like 2 or 3. Let's take 3. Just take a deep breath in through your nose. And if you can't breathe through your nose, you need to because they just found lymphatics right behind your nasal
Oh,
area that
wow.
drains your brain. They just found them. So if you have any type of sinusitis problems, I talk about it in my next thing that you get the free gift, then you might not be cleaning your brain as well. So even if you can't breathe through your nose, make sure you try. Keep on trying, and that will help clear it. So just take a deep breath into your nose and then blow it out hard. Do it again. I mean, do you feel that? So you should sit once, twice a day, take 10 deep breaths, think of something that makes you happy, right? Because when we think of something that makes you happy, instead of the stress that's in our life that we're not feeling well, we feel better, right? Our body changes immediately. So you guys feel a little different from doing the LymphMan shoulder
Yeah, I
shuffle,
do.
rinsing your clavicles and taking some deep breaths. I mean, we really, you should feel circulation through your body. And if you don't, that might mean you're dehydrated and you have thick blood. And that's why many people are put on what? Blood thinners. We don't want to be put on blood thinners. That's the cellular waste that's building in our body.
Mhm.
And a lot of that waste is just senescent cells, which are cells are no longer viable. They call them zombie cells, and I talk more about them later. But zombie cells, we want to get them out of our body. They've been linked to anxiety. They've been linked to diabetes. They've been linked to cognitive loss, right? Meaning when people mice lose their ability to think and the dementia, they see it as waste in their brain, the senescent cells. And Mayo Clinic did a study and they removed the senescent cells from the brains of mice. Anxiety went away. They removed it from the fat in the body. diabetes went away. So everything, hope you see the studies that it's not me saying this anymore. This is real science that we all need to
Yeah.
understand.
Yeah. So I posted the link to John's gift in the chat. For those of you who are watching the replay, just scroll down below the presentation. You'll see the access to that image and description. And then you also have something for our VIP participants, your introduction.
Yeah, and I really just give this to your people. I really made a few. I have an older course, not older course. I teach how to drain the 8-minute routine. It's a whole 8-minute routine. In our 97 course, you get 4 weeks with me, but we just learn in the upper body. So what you guys are going to get here is really a special that I did for Pamela and the group, and you're going to learn how to drain the 8-minute routine that I do. You're going to learn how to drain your body. So it's something. It's a great start to get going, right? So that might be something you want to get. It'll be worthwhile. And you're going to
Hi.
learn some science in that too.
Yes, and it's 50% off with the VIP
Yes.
access.
Yes. It's a good deal. It really is a good deal. And we
Mhm.
all need to understand the lymphatic system. So
Absolutely.
hopefully after today, you're never going to say what's the lymphatic system. So when somebody asks you what's the lymphatic system, you're going to say it's the body sewage treatment system, and it moves around your immune cells and removes fats, cellular waste, and fluid from your body.
Absolutely. And you do have a Facebook group.
Yes, if you're on Facebook, you can go to the Lymphatic System Health Mastery. Just put lymphatic system in for groups and it'll come up. You have to answer the 3 questions to get in, but
Mhm.
I go on every Tuesday.
Yes.
We do a Zoom also. If you go to my link tree, if you go to my page on Instagram, which is John Ossipinsky, there's a link tree. And every Tuesday, but this week, because it's next week, because of the election,
Yeah.
we and everybody, we need to be taking a lot of deep breaths this next week, a lot of deep breathing and moving your shoulders, right? It'll all be over soon, but we're going to be doing our course, our class, and each week I do something different, right? Every few months it's the same thing, but this last week I did anxiety. Next week I think I'm talking about a lot of this science because I have a class
Mhm.
be coming up.
Yeah.
But it's every Tuesday normally at 6 p.m. It'll be changing to because of daylight savings happening
Yeah,
this
that's
week.
right. Because you don't change time, but we do, right?
No, I don't. I hope everybody can stop one
I
day.
know, right? Can we all be on the same page?
It'll make it a lot easier.
Awesome. Any questions from anyone about for John?
And I will tell you a little bit about strokes, right? Because
Oh
since
yeah.
COVID, a lot of people are having heart disease, brain
Yes,
issues.
yes.
And when people have strokes, they know it's about cellular waste building in the brain. A study came out saying when you have a stroke, the brain is bathed in cerebrospinal fluid. Well, we know the lymph system has to clean the cerebrospinal fluid. So it shows that the lymph system
Mhm.
shut down. And that's what really had a major issue or cause of the stroke. So when you're having a stroke, or are in it, you want to really find someone who can help you with that. And again, I teach in our courses a 4-step technique that someone could do on a loved one who has anxiety or someone who may be sick. We really teach a lot more than just drainage.
Yes, you do. You do teach a lot. Yes. Are you still, did I hear you say correctly that you are still doing the telehealth sessions for
Yeah, my deep
uh,
distance lymphatic healing sessions.
yes.
Yeah, we're
Mhm.
doing a special. I put my email in there if anybody wants to contact me. We're doing a 2-for-1. I charge $250 an hour, but you'll get 2 45-minute sessions for that. And that's that I'll record them and you'll be able to listen to them. I listen to recordings and I don't go see a therapist. I drain myself and I listen to recordings that I did on my wife. And you'll have a recording that I do on you, and you'll be able to listen to that and it will relax you, open up your lymph system. It's amazing.
And if you have pets, your pets might join you.
That's right. Pets love it too.
Common mistakes people make when draining themselves.
There's no real mistake, but a lot of places, people will just start draining their pelvis or draining their. You have to open up here first. That's the most important thing, and that's why I'm different than everybody else. I understand the importance not just of draining, your skin or draining your
Mhm.
face. If we don't open up these vessels in your neck that I showed you, then we missed everything. So more than drainage, it's about what can you do a few times a day? Deep breathing, sit up straight, do some twisting techniques, do a little bit of stretching for 30 seconds. That opens up your lymphatic system. So that's where my focus is. What can you do more a few times a day? But if you were to drain yourself, as long as you start up here, some people, like even in craniosacral therapy, they start in the pelvis, they start holding there. Well, that's far away from the major lymph vessels. So I changed my craniosacral therapy to where I start up in the clavicles, right? So it's just understanding that these major lymph drains are everything, right? Think of those major little angel hair pastas that we see that we can have control over, right? Just doing this, rinsing it a little bit, stretching our shoulders can all make a big, big difference in our lives. So there's no mistake, even if you drained a part of your body backwards, it's you don't want to do it consistently. That's why we do want to know really which way it does flow, right? This way we have an understanding.
So open up the main ones first and then.
And that's for everything. If you're doing exercise on a treadmill, you're going for a walk. What a
Mhm.
lot of people tell me, I go for a walk and then my legs swell. Well, because you didn't
Yeah.
open your lymph system, right? So exercise does not always open up those little vessels. They may be really stuck like glue. So doing the LymphMan shoulder shuffle before any exercise, just once. You don't have to do it like before every exercise. Just before you go
Mhm.
exercise, open up your shoulders, stretch a little bit first, then go do your exercises.
Nice. Great tips there. Any other questions for anyone? Has anyone ever done lymphatic drainage? I know some of you might have gone to, massage therapist that does that, um, as
And it's
well.
okay.
Experience.
Understand that
Yeah.
if you're not hydrated, you're gonna get a little detox reaction.
Yeah.
Headache, fatigue, little digestive issue, right? Because that's waste coming out. It has to come out. A lot of people don't realize that. It's really in our bodies and it doesn't come out one session. It could take my feet went from a 10 and a half to an 11 and a half. And it took about a year and a half of my body relaxing. I always had a high instep. I don't anymore. I
Oh,
know
wow.
some women may not want that, right? A little larger feet, but my body relaxed. When we're acidic in our body, everything
Mhm.
constricts, and that's the tightness we feel, even in our feet. And a lot of people have problems with their feet. So, getting the lymph flowing up to these areas will help the legs and the feet.
Nice, nice. Awesome. I don't see any more questions. Well, thank you so much, John. It's such a
All right.
pleasure to
It's
have
been fun. It
you.
always is. I love our conversations together. I hope
Yeah.
everybody learned, right? I hope you learned that you got to take care of your lymph system. You can no longer, you have a choice, old life or new life. The new life is with the lymphatic system, right? And I hope you guys all learned a little something that you can use every day.
Karen said, excellent. Rosie said, chiropractor had someone in his office and I healed back after accident. Oh,
Great.
good.
And I believe in chiropractic. There are
Yeah.
lymph vessels around your spine and inside the membranes that surround your spine and brain. So I believe in chiropractic. I go once a week. But again, it's good that you got somebody who was specific to the lymph system. All
Yeah.
right. I'm glad everybody enjoyed it.
Explained it well. There's another
Yes,
feedback for you.
I love teaching people. So stop by one of our Tuesday or next Wednesday's class. You'll love it on Zoom.
Yeah, and if you want John's upgrade, if you want to upgrade to VIP to get John's course, the link is there to upgrade to VIP. He'll be on day 3 for you
Right.
guys.
You'll be able to take care of your lymphatic system right away.
All right, John, so great to have you.
Bye, everybody.
Yes. Bye.